We will not shy away from any subject, no matter how taboo or uncomfortable they may be. Things like menopause, sex and libido, menopause, dry vagina, hot flashes, mental health and depression. Oh, and that makes you not want to have sex. Oh, and did I say dry vagina? So I'm hoping that I am making some people uncomfortable. I do. I hope that some people may be squirming in their chairs a little bit, but I don't feel bad about it because unless you have gone through menopause, you just cannot imagine. So I have men who come into the store who ask, why do a show only about women? Why do we need to do a show about these sorts of issues? What about the men? That's kind of polarizing. We should have a show about men. Well, we always have shows. I mean, you can throw a rock and see, a commercial about low T or whatever it may be, a new virility supplement, right? So before we get into this today's topic, I'm going to answer that question by doing a little mental illustration. Now, some of this content may not be suitable for all audiences, and it does not take the place of advice from your healthcare provider, but don't do this while driving or operating any heavy machinery or anything else that requires your concentration. So for the rest of you who are in safe places, I want you to go through this little mental exercise with me as I draw a picture that I hope gets you closer to understanding the importance of our issues and why it needs to be normalized in the media and marketing. So here we go. All right, so I want you to picture the most comfortable chair you can imagine. A light caramel colored leather. It's soft. Think of like a restoration hardware chair, right? It's beautiful. It's inviting. You look at it, you want to go to sleep. All right. So I want you to picture that chair, and the seat of that chair. There's about 2,000 tiny little needles that are right in the middle of the seat. Now I want you to go over there and have a seat. Don't think about it. Just go and have a seat on those needles. Okay. Now on the left arm of the chair is a heater that is blowing the hottest air that you can imagine. On the right arm of the chair, there is the coldest air that you can imagine. And the chair that was that light colored leather is no longer light colored. It's dark. Why? Because you are sweating all over the chair. Okay. Now the clock next to that chair reads 2:36 a.m. Why? Because you can't sleep. Okay, your night clothes are super tight because of the weight you gained. Now, that's if you chose to wear night clothes. You break it up a little bit. I'm going to wear night clothes tonight. But they're stuck to you. There are sweat spots on your chest, your underarms, underneath your breasts. You're growing your hair, you name it. You are just sitting in a puddle of water. Okay? Now, I want you to think about a bubble being over your head. And in that bubble, in the shape of a cloud, okay, because we are super cloudy during this time, in that bubble, it reads, wait, I don't remember what I was saying. Okay, so that is the answer to that question. And so for anyone who has a better mental illustration or even tweak mine, something that's more applicable to your menopause experience, I would love for you to call into the studio at 844-STUDIO-4 or 844-788-3464. I'm your host, Dr. Nicole Eastman, and I'm the owner of Rose Pharmacy and Boutique Apothecary located here in Cornelius. And we are a compounding pharmacy with a focus on functional medicine. Now, compounding, what does that really mean? It means that we make medications that are specifically formulated for you in a specific dose or in a specific dosage form that makes sense for you. And what we do at Rose is we help you get through those issues such as what I just mentioned in our visualization, in the most natural way possible while tending to any other needs that you may have. And one thing to note, though, is that not all compounds and not all compounding facilities are alike. One thing that you must think about is we all have standards that we have to meet. We do. And we make sure that we are meeting those standards. We make sure that you are getting the dose that you're supposed to get in the formulation you're supposed to get it. Well, at Rose, we don't do those minimums because I don't believe that my clients want minimums. I don't believe my clients' families want minimums. I feel and I know and I believe that what you should expect in your personalized formulation is that you are getting only what you need and not the things that you don't. And we do this with transparency, meaning that my lab is completely see-through when you walk in. That's one of the first areas that you see. And then we take this concept a step further with our ability to do consultations. We are open Monday through Friday, 10 to 6. We are closed on Saturdays. However, we are open on Saturdays for consultations. So anytime you want a consultation, we can schedule one for you. And if you are taking lots of medication supplements, you're wondering if maybe it's too much, or maybe there's something missing in your regimen, or am I having side effects based upon some sort of interaction that I may be having? Well, that is what the consultation is for. Also, the OTC offerings that we have are products that I'm sure will fit into your lifestyle, many of which complement your current regimen, or in many cases is often a better replacement. So you can find out more about Rose by checking us out on Instagram and Facebook at Rose Pharmacy and Boutique Apothecary, or on our website at roserxboutique.com. Now let's dive into the meat of the show. So our show topic today for our December holiday series is really based upon questions and comments that I've gotten in the stores as the new year is approaching. Questions like, should I consider getting liposuction? Or what can I do if I don't want a facelift? I just want to look like I'm younger, look a little more rejuvenated. Or, and this is the question that brings me the most joy because I was a part of getting them to this point, and that is, now that we're getting my hormones balanced and I have the desire to actually have sex with my partner, trying to get my sexy back, is there anything I can do to tighten and rejuvenate my vagina without getting a major procedure? So for the sake of being thorough, and we know that women want to look new, feel new as we go into the new year, it would be good to address some of the most popular plastic surgery procedures that occur around the holidays and possible alternatives. So we're going to throw in there, of course, that ever popular vaginal tightening, and lots of women are thinking about that after having children and also after going through menopause when we feel like everything needs to be tightened. I know I do. And here to discuss this with us in the next segment is one of my favorite guests, Dr. Josete Guifridda. She is the owner of Refresh Med Spa here in Cornelius, who is an expert in aesthetics. And remember, while we are discussing the topic of possible procedures, I highly recommend two things. One, a very good quality prescription compounded skin formulation to help support your skin's physical beautification. And two, a professional pharmaceutical grade hyaluronic acid supplement that supports the healing of your skin from the inside and out, both of which we can take care of for you at Rose Pharmacy. So with the addition of our consultation services that we offer, it's really second to none what we can add to your regimen, to your plans, to what you're trying to do, and help you figure out what is really best for you. And again, today I think is a good day to call in because we have Dr. Guifridda. She's going to be able to answer some of those questions that you may have around should I or should I not? Is there an alternative? Should I consider doing this over that? I think today is just a great day to get those questions answered. Again, that studio phone number is 844-STUDIO-4 or 844-788-3464, and we'll be right back to jump into our discussion around the holiday nipping and tucking. See you when you get back.
If you have an upcoming event, let WSIC spread the word. Go to WSICnews.com and click on the community calendar button. WSIC, proud to be part of your community.
Here is your WSIC community calendar. Already thinking about what you're going to do in the new year? Several performances scheduled at Kane Center for the Arts are already sold out. Some of the upcoming Kane Center performances include Rocky Lynn, Forever Young, Jeff Allen, and even a Stunt Dogs experience. To see the entire lineup and to purchase your tickets, visit canearts.org. That's CAIN arts.org. Want to see more than 5 million Christmas lights at one time? Speedway Christmas is back. Happening daily, the amazing Speedway Christmas at Charlotte Motor Speedway is happening now through January 7th. The show is open 6 to 10 p.m., rain or shine. The Infield Christmas Village is open Thursday through Sunday nights. Speedway Christmas at Charlotte Motor Speedway, now through January 7th. For tickets, visit charlottemotorspeedway.com. Santa is here. Schedule your time to take pictures between now and Christmas Eve in Birkdale. Appointments include time with Santa and 8 digital images from the professional photographer. For more info and to schedule your time with Santa, visit birkdalevillage.com. Come enjoy Mistletoe Sip and Shops in downtown Mooresville this Friday. Open houses, store specials, sumptuous sips, divine deals, and yummy appetizers. Oh boy! This Friday night, 6 to 8 p.m. Mistletoe Sip and Shops this Friday night, downtown Mooresville. For more info, visit downtownmooresville.com. Have an event you'd like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
And now for a look at your weather forecast from the WSIC Weather Center. We're expecting to end the week with a beautiful day. Sunny skies and a high temperature of 56 degrees. As you head into the evening, skies are going to remain mostly clear. That low temperature tonight's going to be below freezing again. We'll be down at 30 degrees. This has been your weather forecast from the WSIC Weather Center.
Like a present that keeps on giving. WSIC. Be a part of the conversation.
I listen on the way to work.
Have your say.
It's more than just opinions, it's facts.
This is WSIC News Talk Now.
Hello, all, and welcome back to the L Show. I'm your host, Dr. Nicole Eastman, owner of Rose Pharmacy and Boutique Apothecary here in Cornelius, where we compound medication specifically for you. Now, before I started the show today, I was sucking on a sugar-free lollipop.
Sugar-free.
Yes. Now, why mention this? I know it's kind of arbitrary, but the thing about that lollipop is that it had medication in it that I actually needed. So I can swallow capsules, I can, but I'm a compounding pharmacist, so, why not? Why not? And I wanted it to be fun. So, but for the folks who can't truly swallow pills for some reason, say a child, and that's the biggest, I think, population of people that we have the hardest time getting to swallow pills. This is an absolute viable option. And we can definitely look into that option for you. And what about the person who's taking a few different medications? And through our consultation, we find that it could possibly be something that we could combine for you to make your compliance in taking your medication improve. And that is the beauty of compounding, where the sky is the limit. So as promised, our returning guest today is Dr. Josete Guifridda. She is the owner of Refresh Med Spa here in Cornelius, who specializes in cosmetic procedures. Welcome back to the show.
Thank you for having me again.
Absolutely, absolutely. So she is going to give us some alternatives and explain these alternatives to the most popular plastic surgery procedures for the holidays. And if the alternatives actually exist, not all the time that they do, and what she could do for you at her practice as well. Okay, so remember, she is the expert, so this would be a great time to call in and ask any questions that you may have.
The pressure.
844-STUDIO-4 or 844-788-3464. So let's dive right in.
Let's do it.
Breast augmentation.
Yes.
For those of you who don't know what that means, that just means booby implants.
Yep.
Okay.
Basically,
right. A boob job.
enhancement. Yep.
Yep. A boob job.
Enlargement. Yep.
Yes.
It can go along with a lift also.
Okay. So let's get off to the right start. Tell our audience, what does that mean? What does breast augmentation mean? Because it doesn't have to mean increase, right? It could be something else.
Right. Well, typically it involves the enlargement, the enhancement, putting in an implant, surgical procedure, along with the lift. Sometimes there's, I don't even want to say the terminology that we use, but
is it medical terminology?
No, it's
okay.
It's what things may look like after you've breastfed multiple
the
children.
golf balls at the end of socks?
Yes, exactly. I
Yes,
used to
we're going to
tennis
say
balls.
it.
I
We're
usually
going to
say
say it.
tennis
We're going to say
balls.
it because that is exactly the way that they look, and that's the way we feel. So go ahead.
Socks with tennis balls.
Yes.
So with that, you may need a little implant as well as a lift. I am not the expert in that procedure itself, but yeah.
Okay. You mentioned the lift. What is the deal with the lifts? How
Right.
does that work?
Yep. So that's involves a lot. Surgically would involve, cutting and moving the tissue, but as an alternative, we can do something called PDO threads, which are basically like suture threads inserted into the tissue in just the right spot and offer lifting. Now it's temporary. There's no cutting involved or anything like that. So obviously it can only do so much and it's typically for a breast size B cup or less, but it does offer an alternative if for some reason you can't or don't want to go under the knife.
How long does it last? Like, how often do you have to get the lift done?
Different areas or different times. So breast lift usually can last you 6-ish months.
Okay, 6 months.
Yep.
Which isn't, that's not bad. You're not having to do every 3 months or
Yeah.
every.
Yep.
Okay.
Some people make it longer, but like I said, there's that size matters.
So where are the threads inserted or the sutures inserted?
Yeah, so it's actually looks like a long string.
Okay.
And it's inserted, above above the nipple area further up to offer that lifting. So, and there's multiple threads put in there to offer the lifting. Does that make sense? So it's here. Typically up through here.
For those of you
at
who
an
can
angle.
see, she's pointing at an area above,
up here,
like under her shoulder.
trying to get the lift up this way.
Got it. For those of you who didn't see that demonstration, you can always go back to watch the episode.
I'm sure I'm much better in consultations, but for some reason I can't describe it so well right now.
What about some non-surgical things that non-surgical completely, like where you're not having anything done to you? A good bra, for instance.
Yeah, good bra. Wonder bra. Can I say that?
Yes, and I remember the Wonder bras.
Yeah.
They were
wonderful.
a wonder.
Yeah.
Okay, so then instead of going under the knife for breast augmentation, if you have less than a B cup, you could do the lift.
Mm-hmm.
If you have greater than a B cup, then the only option would be something like a bra that could hold you in.
Right.
Right? Okay. Liposuction.
That's a good one.
Are there different types of liposuction?
Yes. Some of them are way more involved where you go to the OR and you get put to sleep and you wake up with less fat on your thighs or belly, or sometimes it goes along with other procedures like the mommy makeover and that kind of thing. You can have it under your chin, arms, anywhere there's fat. And then I heard this just the other day, air lipo. So it's a much milder procedure. You're more than likely awake. There's laser assisted lipo, things that are, much less traumatic than the typical go in there and have you ever watched one of those on YouTube or anything? Like the real deal, go in there, surgery,
Yes.
You're asleep. Yeah. So there's much milder procedures these days.
Now, I would think that there would maybe be areas that you probably would want to be asleep for, or is that not the typical? Or is there anything you can stay awake for? Can you stay awake for all of it, or does it have to be where if you're getting stomach?
I think it depends on the procedure, the type of lipo that you're getting. The most dramatic one is probably you're asleep. The other ones, you may be feeling good, but nothing significant. And there's great ways to numb and do blocks and that kind of thing. So,
okay.
And there's great devices too.
What about some alternatives?
Yeah, so there's actually for like areas under the face and maybe bra fat, that kind of thing. There's Kybella, which causes the fat molecule to break open. There are RF microneedling devices. We have a couple in our place, and that just helps, open up that fat cell so it releases its contents. That can be done pretty much anywhere.
How involved is that, though?
It's not too bad. You actually get numbed in the area. You can get injected with numbing if you need to on the body. We offer a little like Pronox, which is like laughing gas. And so you're feeling pretty decent. And the procedure doesn't take that long itself, maybe 30 minutes for the procedure itself. And the numbing is what probably takes a little longer than that.
What are some of the benefits of the RF?
So many. So it helps stimulate collagen, elastin. It's, minimal downtime. You just do the procedure and go home. Maybe don't exercise too heavy duty for a few days, and healing time is really minimal. Sometimes you look like you have like little screen door track marks kind of things.
Okay.
May feel a little rough, and then that goes away after about a week or so.
What about what you can do for your back is like, the bra area fat that, I would think that'd be a difficult area to really work with. Is that something that you could do the RF microneedling on, or would you have to go through liposuction, do you think?
You could do the RF there. You can also do the that Kybella, that brand.
Just go ahead and say the full name.
I wrote it out, but I always stumble with it a little bit. But yeah, so that one can be injected actually. It just takes a lot of volume, or more volume than some people are, can pay. So in bigger areas, do something like RF microneedling and that kind of thing. I mean, we RF microneedle backs of arms and stomachs, thighs. I'm thinking of all the things that I've had done.
Some of the things that I want to have done.
And then there's a couple different kinds of energy. So there's like monopolar, which kind of shoots through, and then there's bipolar. I know I'm getting really technical, which kind of goes back and forth. But the monopolar works really well under the chin and under the eyes, as far as RF.
And the bipolar works best for
the larger areas.
Okay.
Because the one is called exact, so you're doing like under eye bags and these areas here. Did y'all see that?
Yeah. Again, if you can't see it, you gotta watch the show. What about blepharoplasty? Am I saying that correctly?
Yeah, blepharoplasty.
What is that?
Oh no, now I can't say it. So that's a surgical removal of excess tissue, eye bags. The biggest one done is the upper lid blepharoplasty. I had a friend that had the lower bleph too. I mean, both look great, but and so that's a great thing for youthfulness.
Well, for those folks who want something that's less invasive with great results, be sure to augment your recovery with supplements and products that we can assist you in getting. We're going to continue our conversation with Dr. Josete whenever we're back from break. See you soon.
"76 years strong, and we're still the one." WSIC. News, talk, now.
I'm getting vaccinated with Prevnar 20, a Pfizer vaccine.
So am I, because I'm at risk for pneumococcal pneumonia.
If you're 19 or older with chronic conditions like asthma, diabetes, COPD, or heart disease, or are 65 or older, you are at increased risk for pneumococcal pneumonia. Ask your doctor or pharmacist about Prevnar 20, pneumococcal 20-valent conjugate vaccine. It can help protect you against pneumococcal pneumonia in just one dose. Even if you've already been vaccinated with other pneumonia vaccines, Prevnar 20 may help provide added protection. Prevnar 20 is approved for adults to help prevent infections from 20 strains of the bacteria that cause pneumococcal pneumonia. Continued approval may depend on a supportive study. Don't get Prevnar 20 if you've had a severe allergic reaction to the vaccine or its ingredients. Adults with weakened immune systems may have a lower response to the vaccine. Side effects include pain and swelling at the injection site, fatigue, headache, muscle, and joint pain. For full prescribing information, please call 1-855-213-2138 or visit Prevnar20.com.
And now for a look at your weather forecast from the WSIC Weather Center. We're expecting to end the week with a beautiful day. Sunny skies and a high temperature of 56 degrees. As you head into the evening, skies are going to remain mostly clear. That low temperature tonight's going to be below freezing again. We'll be down at 30 degrees. This has been your weather forecast from the WSIC Weather Center.
Hi, this is Susan. I'm excited to let you know that Lake Mountain Coffee is now available for private events. Our beautiful historic building with its 360-degree mezzanine has hosted many private parties, catered diners, and even an actual wedding. Please contact Andy at 704-252-1886 for more information. Thank you so much.
Senator Tom Tillis is harnessing the power of clean energy to create a stronger America. Building a clean energy economy will create high-wage American manufacturing jobs and expand opportunities for hardworking families to thrive and prosper. Investing in clean energy innovation will strengthen our electric grid and make it more resilient against natural disasters and foreign hackers. Senator Tom Tillis understands that clean energy is vital to America's economic and national security. To become energy independent, America needs an all-of-the-above energy strategy. Wind, solar, and homegrown biofuels can help break our dependence on foreign energy, create a booming economy, and protect our environment for generations to come. America can lead the world in clean energy innovation. Call 202-224-3121. Thanks, Senator Tom Tillis, for building America's clean energy economy. Paid for by Americans for a balanced budget.
The year-end push is on at Randy Marion Ford Lincoln. If you need to buy that commercial vehicle for the tax write-off, Randy Marion Ford in Statesville, we've got you covered. We got everything from service bodies to flatbeds to box trucks, long 24-footers, you name it, commercial-wise, Randy Marion in Statesville has it. Check with the accountant. Make sure you're not going to pay too much in tax for 2023. Come see us today. We can help alleviate that tax bill. Randy Marion Ford in Statesville, right here on I-77, exit 49B.
Thought-provoking conversations and informed perspectives.
It's meant for everyday people to understand, and you don't have to stress about technical terms and stuff. They just say it like a real person.
WSIC News Talk Now.
Hello, all, and welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman, and I own a compounding pharmacy here in Cornelius that you must stop by to see so that you can appreciate the quality and craftsmanship that we put into everything from your experience when you walk in, to the transparency of the lab that we compound your formulations in, to the supplements and beautiful selections of products, many of which you will not find anywhere else. And of course, the attention that we pay to your individual needs. So do yourself a favor and stop by very soon. Now, I'm here with my guest, the awesome Dr. Josete Guifridda, owner of Refresh Medical Spa, also here in Cornelius. Now, before the break, we were talking about blepharoplasty, which is the removal of the tissue around the eyes.
Correct.
Redundant tissue is what you said.
Yes.
So let's continue. So any alternatives to blepharoplasty?
Yes. So a couple. There's actually quite a few. For bags and upper lids, you can actually do a little RF to help tighten that skin. That monopolar or unipolar and bipolar RF you can do around. You can do.
And that's
upper
radio
lid.
frequency for those of you listening.
Yeah,
RF
sorry.
is radio frequency.
I'm like talking to my the regular RF, bipolar, upper lids, and you could do both kinds. Lower, actually, you can do threads. I don't know if I'm on camera, but threads here to lift up brows.
She is pointing right above her eyebrow.
You can do it in a couple spots there. That helps lift. That result usually lasts about 6 months, not as long as like facial threads, which we'll talk about later with the facelift. But yeah, threads there. For under eye stuff, you can do PRP, which is your own platelet-rich plasma. We draw your blood, spin it down. No one's getting queasy on me, right?
Nobody's getting queasy.
And then actually I'll inject it under your eye, or it could be microneedled under your eye. It's good stuff. That helps with like texture and can help if you've got like dark bags under your eyes. And then some people have hollowness under their eye, and filler is great for that in the appropriate candidate. So not everyone, everyone thinks they're a candidate. Oh, I need my under eyes filled, and like, no, you're not a candidate. Sorry. But yeah, so there's some good stuff you can do for your eye issues.
And you do that at?
Yes, we do.
Okay. Next, rhinoplasty.
That's a fun one.
Rhinoplasty, which is a nose job.
Mm-hmm. And that's, trimming it down and making it, a different shape or whatever you may desire within reason.
We've seen some I've seen some crazy ones from people on TV. You don't even recognize them.
Yeah. I've seen people I went to high school with, and then you see them post and you're like, whoa, what happened there? I mean, for the most part, they look great, I'm sure there's always
I've seen some horror stories.
Yeah.
I've seen horror. It's not a good.
Yeah, the nose is kind of a tricky one.
Alternatives.
There are alternatives. There's actually threads you can get inserted in there to change it like the way that your tip goes. You can actually do a little Botox, which I've done before, underneath and on the sides to change that a little bit. I do that. And then fillers called the liquid rhinoplasty. And that's injecting filler along the nose in the appropriate spot. That's for me, I don't do that, and I don't do threads in the nose just because of the risk involved, but I'm sure there are others out there who do that.
Now, before we started talking about this, I do want to say that we know that going under the knife produces, that somewhat immediate result, and you're never going to get results exactly like what you get. But what we want you guys to understand is that there are alternatives that you can choose to do that would be much more convenient, possibly a better option for you.
Less downtime.
Less downtime.
Yeah, like I always say you're not, when people look in the mirror and I have a discussion with them on what they're looking for, and they're lifting their tissue up, halfway up there, you're like, yeah, we can do this, and show them a modest result, because surgery is surgery, and we're not claiming to be able to get results anything like that. But developing realistic expectations is important, and some people can't have surgery or don't want to have surgery. So as long as we're on the same page, it's good, fun stuff.
And those are things that I get in my store. I get people asking, like I said, that's what if I don't want to have any sort of surgery? I just want to do something that will help, but I don't want to go under the knife.
Right.
Next one is facelift, the ever popular facelift.
Yes, that's a good one too. And yes, there's tons of different kinds. I don't even know all the different ones, but there's, traditional, where you've probably seen videos of that, and before and after, and they're all wrapped up and all that. And then there's lower face, there's neck, there's mini, I don't even know all the terminology, but there's eye, this part lift and all the things. So, and then as alternatives for that.
Yeah, what are some alternatives for facelifts?
So combo treatment is really great for that. So do a little RF microneedling. You're stimulating the collagen, elastin, causing the lift. Then on top of that, you do some fillers for volume. The thing about a facelift is, yes, you're lifting tissue, but are you creating volume with that? No, you're not. So that's where I come in.
I didn't realize that.
Yeah. You're just moving the tissue.
You're just moving. It makes sense now that you say that,
Yeah.
but I didn't even think about that. I would think that would be included. Okay.
Yeah. Similar to the lifting threads, you're lifting tissue, so you additionally may need some hyaluronic acid filler, and then also take a supplement of hyaluronic acid, right?
Absolutely.
And Sculptra is one of my favorites to build volume and help with skin. And
Sculptra. What is Sculptra?
Sculptra is, I'm going to get really complex here, PLLA, polylactic acid. So it's sort of similar to the suture material, but it breaks down similarly. It gets mixed with sterile water, injected, and it was first indicated for lipoatrophy, which is like fat wasting. And it's changed as far as like how we reconstitute it and all that stuff over the years, so much less side effects. But yeah, it gets injected and then stimulates collagen, and it's goodness. We always talk about collagen. So collagen supplement too.
Absolutely. Okay, so there are many things clearly that we can do as alternatives to a facelift. Now, one thing that I did see was the ponytail facelift. Seems painful, very painful, because you're having to pull it tighten. We've talked about hair on the show too. That's one of the worst ways that you would want to try to get your face tightened is by pulling on your hair.
Yeah. Traction, hair loss.
Exactly. Okay, so options and options and options for the facelifts. What about vaginal tightening? That is a big, big, big topic in my store.
Yes.
What can we do for that vaginal rejuvenation?
Yeah. So I would start with balancing your hormones.
Absolutely.
Yeah.
Yep.
That would be first and foremost. Then there's devices and injections. I'm sure people probably heard about the O shot and the P shot. That's PRP, like we talked about before, where you draw your blood, spin it down, and then it gets injected in the appropriate place to help with lubrication, rejuvenation overall. It does help with a little, may help with a little bladder.
It's injected into the vaginal area, but you're numbed.
Yes. Yes.
You're numbed.
You're numbed,
okay.
yeah. Of course, it
that's
needs to be as comfortable as possible. And then there's devices you can sit on or have inserted that help with that.
Wow.
Yeah.
Okay, so the O shot, the P shot, that's for, I'm going to say that's for men.
Mm-hmm.
Right?
We said it. Men. Yep. See, you got your.
You're getting your
your due diligence
yes,
here.
Absolutely. So again, remember that we can set you up before you have any procedure at Rose. We can help you kind of walk in the door of your appointment. And for those who are opting for the knife, as I have mentioned before on the show, we have some formulations that are just beautiful. Ones that melt into your skin and helps it heal beautifully. I actually had a client who came into me because she had very recently gotten a burn from a TENS unit, and it was a hole probably the size of a nickel into her skin. And I'm going to actually throw those pictures up on my website in the blog section showing that progression. But we used the SCAR formula. We used the hyaluronic acid capsules. And because it was a hole, I also had her use some aloe vera straight from the plant. So that helps to keep it clean and, infections, that sort of thing. But again, whatever it is that you decide to do, you do need to figure out and come to us and help us to help you figure out what sort of kit you need to start yourself off on the right foot. So when we get back, we still have just another segment or so to go here, and there's still time for you guys to call in with questions or comments, 844-STUDIO-4, and we will see you guys when we are back from break to continue this conversation around nipping and tucking. See you soon.
If you have an upcoming event, let WSIC spread the word. Go to WSICnews.com and click on the community calendar button. WSIC, proud to be part of your community.
Here is your WSIC community calendar. Already thinking about what you're going to do in the new year? Several performances scheduled at Kane Center for the Arts are already sold out. Some of the upcoming Kane Center performances include Rocky Lynn, Forever Young, Jeff Allen, and even a Stunt Dogs experience. To see the entire lineup and to purchase your tickets, visit kanearts.org. That's cainarts.org. Want to see more than 5 million Christmas lights at one time? Speedway Christmas is back. Happening daily, the amazing Speedway Christmas at Charlotte Motor Speedway is happening now through January 7th. The show is open 6 to 10 p.m., rain or shine. The infield Christmas Village is open Thursday through Sunday nights. Speedway Christmas at Charlotte Motor Speedway, now through January 7th. For tickets, visit charlottemotorspeedway.com. Santa is here. Schedule your time to take pictures between now and Christmas Eve in Birkdale. Appointments include time with Santa and 8 digital images from the professional photographer. For more info and to schedule your time with Santa, visit birkdalevillage.com. Come enjoy mistletoe sip and shops in downtown Mooresville this Friday. Open houses, store specials, sumptuous sips, divine deals, and yummy appetizers. Oh boy! This Friday night, 6 to 8 p.m. Mistletoe Sip and Shops this Friday night, downtown Mooresville. For more info, visit downtownmooresville.com. Have an event you'd like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
And now for a look at your weather forecast from the WSIC Weather Center. We're expecting to end the week with a beautiful day. Sunny skies and a high temperature of 56 degrees. As you head into the evening, skies are going to remain mostly clear. That low temperature tonight's going to be below freezing again. We'll be down at 30 degrees. This has been your weather forecast from the WSIC Weather Center.
Stop dreaming about the perfect lawn and make it a reality. Drum Landscape Supply now offers personalized lawn plans. Visit drumlandscapesupply.com and collaborate with our experts. Drum Landscape Supply, your local one-stop landscape shop.
Americans love using their credit cards because they're secure and convenient. But politicians in D.C. are trying to pass a law that will jeopardize your credit card's data security and rewards benefits. Thankfully, Congressman Patrick McHenry is taking a stand and fighting back to oppose this law. Tell Congressman McHenry thank you for protecting our data security and opposing...
Hey, what do you call people who are afraid of Santa Claus? Claustrophobic. Happy holidays.
'Tis the season.
WSIC. Breaking news, expert analysis, and the stories that matter most, all in one place.
I totally acknowledge seeing flames is a scary situation.
WSIC. News, talk, now.
Hello, and we are back with the Elle Show. I'm your host, Dr. Nicole Eastman, and I am very excited to share with you guys that for the rest of the month of December, if you call or walk in and mention the show, you're going to get a free 30-minute mini medication supplement consultation along with 20% off any supplements that you purchase. So this would be a great time to grab a few supplement bundles that are going to allow you to get your new year started off on the right foot. We've gotten some great information today on the show from Dr. Guifridda. Share with the audience where they can find out more about your clinic.
You can go to Instagram. We are refresh_LKN. Facebook, Refresh Medical Spa and Wellness. And the World Wide Web, we are refreshlkn.com. Come in, see us, message us. We'd love to see you.
It's a beautiful, beautiful, beautiful clinic she has. Well, when we were going to break, we were on that topic of the O shot, the P shot. There are so many alternatives and whatnot that really we can assist you with. So please definitely take her up on the offer to call. And also think about, as you're figuring where you want to be, what you want to look like, realistic expectations, it's good to have a conversation with someone who knows versus going on the internet, things like that. That's where we...
Dr. Google.
Dr. Google is the name of that person. So we haven't gotten any questions today, but that's okay. I want to talk to you guys about a couple things and really ending off the portion of the segment with the nip and tuck. No matter what procedure that you plan to have, there are things that you do need to have on board. And Dr. Guifridda, she will absolutely confer with me on this. Collagen, absolute necessity. Zinc is another one that's very, very, very important. Zinc is, like we talked about, it's the Botox. It's like a Botox accelerator.
Extender, yep.
Extender.
Yep, you need zinc to have your Botox last as it should and take effect. And there's some small studies that support that. And what's zinc going to do? Not going to hurt you. So.
Not going to hurt you. And really, the way our bodies with zinc, we need zinc in order for us to have appropriate bodily functions in many other areas. So if there are things that you need to be on, I'd say collagen, zinc, why do I always, I can say it until I can't say it, right? Hyaluronic acid. Those are 3 things that you absolutely must be on during this skincare journey, and actually all the time, in my opinion. Yeah. So in the news, tirzepatide. You all may know it as Mounjaro. It is really hot right now because of weight loss.
Just got cleared.
Yep, just got cleared for weight loss under the name Zepbound. That is the brand name for it. So it really is just like Ozempic and Wegovy. They're the same 2 things, just branded differently. Tirzepatide
has that one more receptor.
Yes, has one more receptor. It is a dual agonist, what we call a dual agonist, which means it works on 2 different receptors in the body to help to improve your weight loss, essentially. Well, the problems that we're having, and I get these calls into my store all the time, is the availability. So whatever it may be, it could be the Ozempic, it could be the Mounjaro, it's the availability of the product. And really what's going on is that the manufacturers are having a very difficult time keeping up with the demand. We have people using it for weight loss and people who are using Ozempic for weight loss, the branded Ozempic for weight loss, and the branded Ozempic really should be being used for those patients with diabetes. Because what's happening is that I get those calls. The reason I'm getting those calls is because those people cannot get Ozempic. We have diabetics who need their medication, but they can't get it because it's not available. So I don't believe the manufacturer, and you can kind of chime in on this too, Dr. Guifridda, the manufacturer, I don't believe that they planned on the response to this. The TikToks, the stars that are using it and getting the Wegovy face, right, that are getting these dramatic.
I can help with that, by the way.
Yes, with some filler, right?
Yeah, exactly.
So, they didn't plan on the response in the market, and now it's the quick recoveries. Now I'll say this. There are ways that people can get still the medications that they need, but they're going to have to rely on compounders who do sterile compounding. Now, sterile compounding and non-sterile compounding is 2 different areas in compounding. Sterile, we reserve for things that are going to be injected into your body. The non-sterile are things like the orals and the creams and the capsules and things like that. So the sterile compounding pharmacies, they are now stepping in to provide an alternative for people. It's really not, it's the same thing, but they're stepping in to make sure that people don't go without. So I just want to give high fives to compounders who are really getting into this space and making sure that people can still get taken care of. But for those who are listening who may be on Ozempic or who may be on Mounjaro and are having issues getting those medications, there are alternative ways to get them. I'll tell you, going into a med spa probably is a good idea because they're the ones who are typically going to know where, and they're sourcing it from a reliable source. So there are options beyond what you think are just typical to make sure that you don't have any gaps in therapy. Also, one thing that I read recently around tirzepatide, there are possible concerns with interactions due to absorption being delayed. Now, what that means is when you take a pill or you take something internally, our bodies need to be able to absorb what we're trying to get out of that pill. And what happens with tirzepatide, your absorption slows down, which means that you could be getting delayed effects from your medications or not getting the peak effect that you need. Birth control is one of those things, and I believe that tirzepatide is one of the only ones who has that as a watch out in their leaflet around birth control pills. It hasn't been out long enough to really look at long-term studies because, again, that requires length of time of being out in the marketplace. But that being said, if you are taking tirzepatide and you are on birth control pills, if you're on birth control pills because you are trying not to get pregnant, the best thing to do is as soon as you begin taking tirzepatide, you want to use an alternative form of birth control for the first 4 weeks. And the way these medications are dosed is that you go 4 weeks, you're taking it once a week for 4 weeks, where you're injecting it once a week for 4 weeks, and then you go to step progression to the next dose. Well, when you go to that step progression to the next dose, go ahead and start using an alternative form of birth control. Okay, so that's just one watch out here, and I just bring this up because, again, this is something that oftentimes comes up in questions and things that people don't think about as to why we need to change up things when you're taking two medications that could possibly be interacting with one another. Another thing that I really want to bring up just really quickly is that estrogen is an absolute game changer for anti-aging and for skin and for vaginal support. That's one thing that we didn't talk about, but I do want to make sure that I mention that. When we're talking about vaginal rejuvenation, getting the skin back to the way that it was and the dryness and whatnot, estrogens are an absolute game changer. Specifically, estriol, I know that it works. Estradiol, I know that it works. Estriol, we would do that once a day for 14 days, and then we do it every other day, or 2 times or 3 times a week, but typically we get great results with that. That's another thing that I'd like to just share and put out there. But again, as we said, always be on zinc, hyaluronic acid.
Ava Longoria,
hyaluronic acid, and collagen. Those are the things that you want to always make sure you are ingesting. And I want to thank everyone who tuned in this week for this segment of the Elle Show. Remember, again, I'm your host, Dr. Nicole Eastman, the owner of Rose Pharmacy and Boutique Apothecary, and a huge thank you to my guest host, Dr. Josete Guifridda. And for those who missed any part of this show or any of the previous shows, you can find them on WSIC News, or you can watch them on Facebook. We're also on Apple Podcasts and Spotify. She did a lot of visuals on here, so I think it's a good idea for people to go back and see what we were talking about with the lifts and the nose and the brows and whatnot. I once again invite you guys to come and visit me at the store, 20035 Jaton Road, Suite B in Cornelius. I'm directly behind McAllister's Deli and Circle K, and we do have so much to offer and can personally help you on your healthcare journey no matter where you are on that road. Or what about the loved one that needs a little additional TLC with regards to the drawer o pills, okay? Gifting them a full consultation could do just the trick to get them on track. And I would be remiss if I didn't mention the beautiful selection of unique products that you can only get at my store. Block off that 3 to 4 time slot every Friday with the Elle Show, so this can be our happy hour. We're wrapping up our busy week together on a very uplifting note. Have a great weekend, guys. Bye.